Recent reports of confirmed cases of a strain of the plague came in from Ciudad Juarez, Mexico, a U.S.-Mexico border town just 8 miles from El Paso, Texas. Being so close to the border, the United States may need to prepare to take similar precautions as with the recent Ebola scare. Hello, this is Andrew McKinnon with CNN. Understandably, Americans are nervous about a possible epidemic. The World Health Organization has verified cases through the Outbreak Verification Team's reports to the Global Public Health Information Network and confirmed the outbreak. Here to comment on this outbreak is microbiologist Nathaniel Stanley. Dr. Stanley, can you shed some light on what the plague is and the extent of the outbreak thus far?
The most well-known plague outbreak was in 14th century Europe, where it killed hundreds of thousands of people in approximately 5 years. There are 3 forms of plague that result from the bacteria Yersinia pestis: bubonic, which attacks the lymphatic system; pneumonic, which attacks the respiratory system; and septicemic, which attacks the bloodstream. Bubonic plague is spread by vectors, which are non-human transporters of the disease, such as ticks and rats, or by touching contaminated animal tissue. Pneumonic plague, which is present in Mexico, is airborne. It becomes airborne when the other forms of plague are left untreated, allowing the bacteria to infect the lungs. The disease has a fatality rate of 27%. The number of confirmed cases in January of this year was at 119, with a mortality of 40. But in February, the mortality jumped to 71, a difference of 33 cases within a single month.
Is there a cure or vaccine for pneumonic plague, or are we truly about to relive the same scare as with Ebola?
Currently, no, there is no vaccine for pneumonic plague. The best combatants are antimicrobial or natural resistance, but even now we are seeing antimicrobial resistance in this strain from Mexico.
How should we go about preventing this disease, Dr. Stanley?
Well, given that pneumonic plague is spread from person to person by way of close personal contact, those infected should be isolated until treatment has taken effect. When in the presence of someone infected with pneumonic plague, wearing a tight-fitting surgical mask offers some level of protection. Additionally, pest and vector control are vital for preventing the future cases. The bacteria is found in rodents and their fleas and ticks, thus we must be sure to attempt to eliminate these factors from the environment.
What are the symptoms of pneumonia, and is there a treatment available?
The initial signs of pneumonic plague are fever, headache, weakness, and a quickly developing case of pneumonia. This pneumonia causes shortness of breath, chest pain, and cough. This is a rapidly progressing disease, as within 2 to 4 days the pneumonia may cause respiratory failure and shock. For this reason, early treatment is vital. Antibiotics must be given to the patient within 24 hours of the onset of symptoms, otherwise the chance of death grows exponentially. In addition to treating the patient, antibiotics should be provided to those in close contact with the infected, preventing them from suffering a similar fate.
Let's turn to Allison Verbila, Editor-in-Chief of the Juarez Tribune. Ms. Verbila, are there conditions in Juarez that facilitate the spread of this threat?
Hi. Well, Mr. McKinnon, similar to other large cities, there is a bus system that connects each part of the city. This makes it fairly easy for the disease to be spread on a local level since it can be passed by spread of aerosolized droplets. All it would take is one person being sick on a crowded bus in order for them to infect another person. This city also serves as the gateway to the north, and there is concern that the pneumonic plague could pass over into the United States, such as into El Paso, Texas. There also is some concern about the food being served in small restaurants. We're not sure at this time whether or not there have been restaurants serving field rats as part of their cuisine. This delicacy in Mexico is a fairly dangerous one, as sometimes city rats are sold in markets as field rats. As of right now, we don't have any confirmed cases of city rats being used here in Juarez, but it has happened occasionally in the past. Eating an unclean rat could result in acquiring the infection.
What can you tell me about the population of Juarez?
The population in Juarez is 1,332,131 people, while the density is about 7,000 people per square kilometer. To put this in perspective, the population of El Paso is 2,250 per square kilometer.
What is life like in Juarez?
Culture plays a big part here too. As in other Latin American countries, it is customary to greet people by kissing on both cheeks instead of just shaking hands. This practice can make it very easy for the pneumonic plague to spread. Life in Juarez also means living with your siblings and your entire extended family. Mexican families tend to be very loyal and work as a unit rather than as just individuals. The needs of the family are greater than the needs of the individual. With families here being so close, it is plausible that if one family member becomes infected, it could spread to the entire family. Also, typically there are few people who prepare all the food in one family. If the food that everyone eats is handled by a person who is ill, it can be spread to the remaining members of the family. Large households provide a great opportunity and a great way for the virus to spread. Heroin has also become a huge problem in Juarez, and the sharing of needles could spread the disease as well. The cartel operates here, and over the past few months, the price of heroin has gone down and has created more of a drug problem than was here previously. We fear that some of the migrant farm workers who travel over the border into the U.S. daily could become part of the problem as well. In order to contain the illness, there would have to be strict control of the influx of people from Mexico into El Paso. The migrant farm workers could easily pass it through the food supply if they were handling food products on the way to being sold.
Let me turn to Dr. Ford with the Global Institute for Containment of Infectious Disease. Why are we worried, Dr. Ford, about this disease spreading into the U.S.? What are the environmental dynamics at play?
Yes, Andrew, thank you for having me. Many viewers may know that Juarez lies in northern Mexico, along the Rio Grande, just below El Paso, Texas. In fact, the state of Chihuahua, in which it is situated, shares 582 miles of border with Texas and New Mexico. There are 4 bridge ports of entry connecting the two cities, which combined allow about 23 million crossings per year. These constitute the major port of entry into the United States for all of central northern Mexico. 2 railways cross the river into the U.S., and moreover, there's a nearby land crossing, and also the international airport in Juarez. The riverbanks allow propagation of rats, as does the poor sanitation in the region. Raw sewage and industrial effluents pollute the Rio Grande and other freshwater resources uncontrolled.
What are the economic implications for Juarez and for the U.S. should this disease spread across the border?
Well, economic and social insecurity is prevalent in Juarez, even though it's now a major manufacturing center. The U.S. imports a variety of food products from Mexico, and also vehicles, fuel, and oil, machinery, medical instrumentation. Much of the bilateral trade between the two countries is processed through the Juarez-El Paso ports of entry, which increased dramatically subsequent to the passage of the North America Free Trade Agreement of 1994. U.S. trade with Mexico totaled $536 billion in 2012. The U.S. has been heavily invested even further in Juarez since the institution of the Border Industrialization Program several years ago. Mexican labor is cheap. It's kept cheap in order to retain U.S. firms operating assembly plants there. Mexican women work for about 1/6 of the U.S. hourly rate. These operations, maquiladoras, are duty-free and tariff-free, making them more attractive to foreign companies. However, the rapid industrialization from what was previously agricultural and ranching has created population density problems and other evils, like pollution and poverty that instigate the spread of diseases, like plague. 52.3% of the population live below the poverty line. Any major disruption in daily life and activity in these operations affects supply and prices here in America, and right now stricken families are losing school and work hours to care for their sick. What's more, the panic created by social media reports has nearly brought the city's economy to a standstill.
Dr. Ford, is the healthcare infrastructure in Juarez such that containment is even possible? What are the national and geopolitical risk factors of this outbreak?
The ability of local authorities to contain a major disease outbreak is limited at best. Juarez County has 147 localidades, or townships, with differing jurisdiction at varying levels of professionalism among the police agencies. The medical system is socialized. State and federal governmental healthcare institutions offer services as well as private clinics and hospitals, but nearly 1/4 of the inhabitants are uncovered by any healthcare. There's an enormous deficit in the medical infrastructure for healthcare at both the primary and secondary levels. So coordination of the response is a problem, as well as managing security and maintaining control among afflicted persons.
What has been the international medical response?
Andrew, keep in mind that Juarez has the reputation of the most violent city on earth. It's no wonder that mobilization of international healthcare efforts has been difficult. Travel advisories are continuous. Juarez is the locus for Mexico's most powerful drug cartels to pipe cocaine, heroin, ecstasy, methamphetamines, and other illegal substances into the U.S., which create a prevalence of all types of violence and crime committed between gangs and against citizens, such as extortion and maybe money laundering. Viewers may be familiar with the name Guzman, the most wanted drug lord in the world. Hundreds of homicides occur each year, mostly drug-related, but with significant collateral deaths. And in the past, waves of murders of young working women have occurred unrelated to drugs. So it's this fear that's keeping healthcare workers at bay.
Ultimately, social, political, and environmental changes must be addressed in this region to thwart the emergence of plague or any infectious disease. While vaccines, pathogen control, and modern medicine can be used to stop the spread or break the chain of an epidemic like this one, public health, which entails assessment, policy, and assurance, is key to the prevention and therefore public, national, and international safety in the long run. Thank you and good night.